National Collaborating Center of Methods and Tools, NCCMT, which involves sharing knowledge, deploying tools, and providing training to public health practitioners across Canada. Engaging practitioners provides them with the confidence from knowing they are making informed decisions about the health of communities across the country. In addition to a BSc in Biomedical Sciences from the University of Waterloo, Emily has earned an MSc degrees in Health Research Methodology from McMaster University and in Biology from McGill University. Most recently, Emily worked as a clinical research coordinator for Hamilton Health Sciences. So over to you, Emily. You can please start.
Wonderful. Thank you so much, Emma. I appreciate it. And if you can confirm, if somebody can confirm that you are able to see my slides, that would be great. So thank you so much for the introduction. As Emma mentioned, I am a knowledge broker at the National Collaborating Center for Methods and Tools. So my role involves product development, training, and outreach. I will give just a little bit of a very, very quick overview of our organization just to provide you with a little bit of context. The NCCMT is one of 6 national collaborating centers across the country. We were originally founded to address knowledge gaps in public health that were identified during the SARS outbreak in Toronto. The collective goal of all the NCCs is to improve the health of all people across Canada by sharing knowledge, providing training, identifying gaps in knowledge and practice. And as you can see by the titles on the screen, each of the 6 NCCs focuses on a specific area in public health, and we are also each hosted by different organizations. So here at the NCCMT, we are hosted by McMaster University. At the NCCMT, our focus is on championing the use of evidence in public health decision making, and we do this through a number of different strategies, including curating the latest research and evidence on what we know works in public health. We share knowledge and help develop skills for integrating evidence, and we support public health practitioners so that they know that they can be confident in the decisions they make because those decisions are based on the best available evidence. I will hand it over very quickly to our other speakers, but a few things that we have that can help you prepare for what is becoming an increasingly evidence-informed workplace. We do have a tool that will assess your learning needs, a skills assessment tool. It's 20 questions that will take you through different areas of evidence-informed decision-making, statistics, and provide you resources where you have some need for improvement. You can develop your skills with our online learning modules. There is both a free version as well as a certificate program through McMaster Continuing Health Sciences Education. There's a fee for $100 for students, but this is a really great certificate to then have on your CV once you enter the workforce, showing your commitment to and understanding of evidence-informed practice. And I will also point out our Understanding Research Evidence video series. These are a great way to brush up your skills or your knowledge on different statistics concepts. If you were like me, you only remembered what you needed for the test and gladly forgot a lot of statistics. So these are a great way to just refresh what's a p-value, what's a standardized mean difference, and really quick and easy and not condescending ways to explain those. And then we also run Health Evidence. Health Evidence is a repository of almost 6,000 systematic reviews of public health interventions, and they're all quality rated. When you sign up for the Health Evidence site, you can actually select which topics you're interested in, and every month you will get a evidence service email to your inbox that shows you the very latest evidence in those specific topic areas. So it's a great way while you're in school and then once you're out of school to kind of stay on top of relevant topics. So before we jump into, oh, and I just realized we haven't updated this slide, but Emma, if you start the polling question, so I think I have updated these, but if you are able to start the polling question, we were very interested to see where our audience is actually joining from, which parts of Canada, which provinces or territories in Canada. So Emma, have you started the polling questions?
Hi, sorry, I was muted.
That's
Yep,
okay. Yeah.
the responses are coming through. We have the majority of participants in Ontario,
Okay.
close to 70%, and then a few from the prairies and BC.
Wonderful. Thank you so much. We appreciate you joining from wherever you are. And I will go to our next question. We're curious to see how many of our audience members are currently students enrolled in an MPH or other program. If you have recently graduated and now you're looking for an opportunity to get started with your careers in public health. If you are working in public health, or if you are somewhere else in your career right now. So Emma, I will let you monitor those responses, and just because I can't see them, if you don't mind summarizing them again, that's really helpful.
Yes, so once again, the majority, around 60%, are current students, with about close to 30% recent graduates looking for opportunities.
Great.
Then we have a fifth, 20% working in public health, and 12% said other.
Perfect. Wonderful. Well, congrats to those recent graduates, and we hope that today's webinar will be helpful as you're looking for those opportunities. And then just to get an idea of what your focus was, what type of MPH program? Was there a specialization? We have options for the general stream if you were looking more at epi or biostatistics, unlike myself. If you're interested in health promotion, environmental health, or something else, and feel free, of course, in the chat to enter if you don't fall into any of these, what else you were focused on.
Okay, we can give people another couple of seconds to vote. I think voting has ended, and now I can actually, I see, I can share results. Are you able to now see the results?
I can't, but I'm also in
can.
full screen mode.
Okay, so we see that the majority are in general stream, around 40%, followed by 30% in health promotion, and then closely followed by 20% in epi, 14% in environmental health, and 14% in other.
Wonderful. Thank you so much. And we have one more question. We wanted to know, where are you hoping to land in your public health career? What type of career are you planning on pursuing? Whether that's frontline program delivery, data, epidemiology, whether you're interested in the policy side of things, if you're looking to enter the research field, or if there's something else that you're interested in. And this will be our last question before we hand it over to Nancy and Shovita. So
okay, results are still coming in.
Perfect.
And okay, I think we've crystallized. So 60% are looking to pursue a public health career in program delivery, with half in policy or government. So people have the option of choosing more than one here. So definitely an interest in program delivery, policy, and government as the top ones. And then data and epi and research are sort of tied around 35% each, and then 8% in other.
Wonderful. Thank you so much. So I am looking forward to hearing from our other panelists as well. The NCCMT, we were very happy to bring these panelists together to you through this webinar. We had done some outreach with a number of the MPH programs across the country, and this seemed like a really great opportunity once I saw the posting for webinar ideas to help get some of these messages directly to the students. So I will wrap up here, and I look forward to hearing from everybody in the question and answers. I will stop sharing now. Perfect.
Great, thank you. So while Dr. Patty is getting her slides ready, it's my pleasure to introduce her. She currently works as a medical health officer and medical director at Fraser Health on the traditional and unceded territories of the Coast Salish Nations in British Columbia. She's also a clinical assistant professor at the School of Population and Public Health at the University of British Columbia, an adjunct lecturer at the Dalla Lana School of Public Health at the University of Toronto. Dr. Patty completed her undergraduate degree in kinesiology at McMaster University, medical training at the University of Ottawa, and MPH and residency training at the University of Toronto. Dr. Patty became a Fellow of the Royal College of Physicians and Surgeons of Canada in Public Health and Preventive Medicine in 2013.
All right, thank you, Emma. Can you hear me okay?
Yes, and your slides look great, thanks.
Great, thank you. To have you all, be so invested in your careers, and I hope we can provide you with some great advice. Oh, it says I'm muted, but okay, hopefully you can still hear me. Emma, let me know if you can't hear me.
Sorry, you're not on mute.
Oh, okay, great.
Yeah, thanks.
As a disclaimer, so Emma outlined all my various positions, but I do want to state that this presentation reflects my views and not the organizations that I'm affiliated with. And if you do feel yourself reacting to some of the things I said, feel free to email me at the address below. I just want to highlight this really important link located at the Government of Canada's website. And you can see the link below, but this is the core competencies for public health in Canada. And I think as public health practitioners, it's really important that you review these core competencies and make sure that you're actually acquiring them during your training. And if not, connect with your instructors to see how you can develop those competencies. In local public health, that's what I'm really speaking here about. We have several positions that actually have individuals who have an MPH degree. So medical health officers like me, a lot of our nursing and clinical staff, as well as our managers. I'm going to focus on three key positions where individuals come to work from us who have just an MPH and no other professional designation like nursing or public health inspectors. And those would be our epidemiologists, our policy analysts, and our community health specialists. So what I'm looking for in potential employees, I'm going to divide this up by sort of different areas. But for specifically those of you in the epidemiology stream, what we're really looking for are people who have a strong working knowledge of SAS or R, experience working with large, messy data sets and merging data sets together, because that's what our real life is. Public health at the local level is extremely messy. Understanding technologies such as Tableau and methodologies such as machine learning, health equity analysis, as well as visual analytics. GIS mapping is also a huge asset, and that's something we look for. With respect to the remainder of the MPH candidates who may not be in the EPI stream, really understand the ability to understand data and translate it into action. So learning to use run charts, being able to implement initiatives that are data informed and data driven. Also having knowledge of various data sources in Canada, whether it's our administrative databases or through community-based organizations or other human services such as police or fire department. There's a lot of great data out there that could help inform our work. And just having the ability to do and support evidence-informed public health. And so I'll give another shout out to the NCCMT with all their wonderful modules and certification courses. I highly recommend those as they do prepare you with those skills. With respect to communication, this is important in every job, really. And with respect to public health, for all graduates of MPH programs, being able to do knowledge translation of data for non-scientific audiences. So really getting out of the jargon, and you can't sit there quoting odds ratios and relative risks to the public at large. They're not going to be able to understand that, and it's not going to really capture their hearts or their minds. Also finding an ability to write in a variety of formats for different audiences. This is literally your marketing 101, knowing who your audience is. So whether you're doing a briefing note for the minister's office or a technical report that you're sharing with other colleagues, versus a lit review or a lit summary or a one-page summary for the public. You really need to grasp and understand your audience and what they'll be able to take from that information. Public speaking and strong presentation skills are also an asset. So look at different Toastmaster skills courses, things like that. That would be really helpful. In particular with the health promotion and community health stream, really having the ability to translate health promotion theory into practice, as well as super strong community engagement and development skills. And that this specifically applies at Fraser Health and our community health specialists, because they do a lot of engaging with various community partners. Project management. So our policy analysts at Fraser Health, they do a lot of project management. And what we're looking for is the ability to plan and manage projects independently. Sometimes you can get additional certifications following your degree in actual project management. It's a PMP designation, so you may want to consider that. But having the ability to do things like create a project charter, outline project deliverables, and create a Gantt chart expressing timelines. Having the ability to facilitate strategic sessions is also a massive asset. Super strong organizational skills, just being able to, put documents onto SharePoint, have them filed accordingly, so you can find them at a snap of a finger. That's really important. And having a basic understanding of program evaluation, recognizing that program evaluators undergo their own respective training, and those are also potential employment opportunities in local public health. Other skills for all graduates, and I can't stress this enough, is looking for basic professionalism. So be on time, don't ghost. This ghosting thing is, it's actually blowing my mind how people aren't replying to emails, or even responding like post-job interviews. It's actually happening to us. So it's really inappropriate. And I think it's really important for all of you to recognize that public health in this country is actually a very small community, and word will get around. So really make sure you are putting your best foot forward, your best face forward, and behaving in a professional manner. The ability to work independently. And I would urge you all to really develop and hone this skill on your practicums. I think you should consider all your practicum opportunities as a potential job interview that goes on for 3-4 months. And what I look for is students being able to hustle, to work independently, to anticipate. We actually rarely hire new grads straight out of school. And it's because they are lacking the ability to work independently. But if you can demonstrate that on your practicum, it increases your chances. Being politically astute, we work in highly politically sensitive environments. And, whether it's just keeping up with the news, but also recognizing that there's a way to bring forward controversial ideas without burning bridges. Being able to prioritize your work and as well as working in an extremely fast-paced environment, local public health, in my view, is actually probably the most rapid pace, and you're literally running during the day. So being able to handle that. Self-awareness, this is a growth opportunity throughout your entire career, but looking at things like your Myers-Briggs type, how do you process information? How do you receive feedback? Having a good understanding of that. And I think your respective universities' career centers can actually help out with that. And so I urge you all to, while you're still in school, to connect with your career centers to help assess these, do these psychometric inventories on you. Creating a network of colleagues in a community of practice is really important. Like I said, we're a very small community in Canada, and a lot of us are doing similar work, so why not stay connected and share all that great work? Lastly, as we move towards the end of my presentation, being open to working outside large metro areas. Be prepared that you're not going to get your dream job right out of school in Toronto or Montreal or Vancouver. And what I love about public health is that it's amazing wherever you go across this country. And actually, as a new grad, you will have more opportunities to grow and flourish, I feel, and this has been my experience as well, by going to smaller centers. And also, lastly, we do value individuals with lived experience with marginalization, with poverty. And so don't, feel be comfortable with sharing that as much as you do feel comfortable doing that. But it's a huge asset. A lot of us, we try to check our privilege in public health, but it's really important that we have as many people with lived experience also informing our programs and services, so that way we can maximize our impacts. So I'll just leave it at that. And here's my email again if we don't get to your question during the question period. And I'm going to hand it over to Nancy.
Terrific. Thank you so much, Dr. Patty. And I'll take this time as Nancy is getting her slides projected to introduce her. She's a program manager with the education and research team at the region of Peel Public Health. Nancy has a Master of Science in Community Health and Epidemiology from the University of Toronto. She started her career as a research coordinator at the University of Toronto and has worked in local public health for 10 years. Nancy and her team support effective public health practice within the department, including the use of data and evidence to make decisions.
Hi, sorry, can you guys hear me?
Yes, we can hear you.
Okay, but can you see my slides?
I'm not seeing them.
Sorry, I will admit to everybody I got a new computer this week. And
sorry. Yeah, we are seeing them, not in presentation,
okay.
Not in full screen view. Sorry.
Okay.
Yep.
So if I can, okay, is that better?
Yes, perfect. Thank
Okay.
you so much.
Thank you. Okay. So thank you very much for asking me to present today. As it was mentioned, I'm a program manager at Peel Public Health, and I'm going to be presenting on how Peel has been building capacity to ensure that our staff are able to effectively practice public health. Oops. So given the variety of structures in public health in Ontario, at least for now, I thought I would start by situating Peel Public Health as a health unit. So Peel Public Health is one division within an upper tier municipality, which is the region of Peel. Our medical officer of health is responsible for public health practice in 5 divisions. So that's the Office of the Medical Officer of Health, Communicable Diseases, Health Protection, Family Health, and Chronic Disease and Injury Prevention. So graduates from post-secondary public health programs would be found in all of these 5 divisions. However, the work that they would be doing would be very different. And so I'm going to preface the next part of my conversation or presentation with the fact that my perspective comes from what it's like to work in a large local public health unit in Ontario. But as the previous presenter said, each environment is very different, and the work that each public health unit does is very different. So in terms of the workforce we have here at Peel Public Health, we have just under 800 employees as of March of this year. And this slide shows the breakdown of sort of the 6 most common roles within the organization. So you'll see from the graph that about 10% of our workforce are what we would call research analysts, research and policy, or health promoters. And increasingly, those would be people who hold a graduate level degree in public health or a related field. And we have about 32% in this other category, which would represent sort of 20 other positions within public health that might be of interest to you, things like epidemiologists, health analysts, and some of our more technical roles. So that leads me to this slide, which outlines really what we're looking for in new hires from a post-secondary public health program. So as Shveta said, all public health staff are expected to have the Public Health Agency of Canada core competencies, and they develop those sort of through their training, but then within the first 2 years of their career. I'll speak more about those in a minute. But in addition to these, depending on the particular role, there might be specific competencies that would you would require to be able to complete the work. So, for example, there are specific role-specific competencies for nutritionists, epidemiologists, and public health inspectors. And then within Peel as an organization, we also have our corporate leadership and employee competencies that all employees must demonstrate to be able to, on an annual basis, for our performance appraisal process. So aside from what I would term sort of the technical competencies, there are a number of other characteristics that we're looking for in new employees. So as was mentioned before, communication is an extremely important skill to develop, and including oral and written communication, and for a variety of audiences. We find often that people need to communicate the same type of information to many different audiences, and you really need to be able to adjust that communication style to meet the audience's needs. I'd echo the comments from before about the importance of project management. We have often people are working on a number of different activities at the same time, and being able to keep them all moving forward and being really clear with everybody about the sort of the status of things as a project is very important. Cognitive abilities, people's ability to think critically about the work that they're doing, being able to synthesize multiple forms of information together to bring it into a cohesive whole, are really things that are key aspects in the health promoter or analyst role, and they really are what people hone over time as they, either through their practicum experiences or their early work experiences. Your ability to demonstrate these characteristics is extremely important. And more generally, things like your adaptability, openness to feedback, some personality and motivation things such as your sort of social and interpersonal skills, emotional maturity and resilience, and drive and initiative. These are things that we are really looking for in new employees to be able to work in the sort of fast-paced and ever-changing environment that public health is. So some of these things, they're kind of inherent skills to individuals, but definitely they can be enhanced in the workplace with experience and mentoring by staff, either your direct supervisor or other staff within an organization. And I would say that these are the things that often are missing when people are coming directly out of school. These are the types of things that you really need to be able to demonstrate so in a job interview, how you're able to do these things or demonstrate these skills. So coming back to the core competencies, as was mentioned before, I mean the core competencies are a listing of really the essential knowledge, skills, and attitudes that are required to practice public health. And they can be considered the building blocks for an effective public health practitioner. And here at PO, we use these core competencies within our workforce development strategies. So for example, they would be built into our job descriptions, which would mean that when a job is posted, it would have the expectations in these particular areas for each position. And you could expect that you would probably see them surface again at a job interview to be able to describe how you have demonstrated these core competencies. And then once somebody's actually been hired into a role, they would be supported in the organization to continue to develop these skills through either formal training opportunities or on-the-job learning experiences. And so the areas in the core competencies are about public health sciences, assessment and analysis, program and policy planning, implementation and evaluation, partnerships, collaboration and advocacy, diversity and inclusiveness, and communication. So I myself find the list actually quite daunting, but there are a lot of competencies that are deemed as core, but I do actually think it's quite helpful as a framework for thinking about how you might want to develop your skills over the course of your training and then your career, and how you want to build in these specific areas. So it's recognized, I think, that students who are entering the workforce are not going to have all of the skills right out of school that you're going to need to be able to practice public health. So rather, here we talk about the fact that the formal training that the students receive, it's probably only contributes to about, sort of 10% of anyone's knowledge or skills. Another 20% of that learning really comes from coaching from others, including either your direct supervisor or other leaders within your workplace. But by far the vast majority of skills and knowledge is actually gathered through on-the-job learning and the application of your training in a real-world context. And for students, that's mainly developed through your placements. So again, in thinking about career planning, we encourage our new employees to look for opportunities to learn these new skills on the job as it relates to their role. And so sometimes I'm asked, how to maximize that sort of on-the-job learning. And these are just a couple of the ideas is, when you're attending meetings, really observing how the work is being done, looking for mentorship or job shadowing opportunities, reviewing job descriptions in an organization to see which ones are of interest to you and what the expectations are and the qualifications. We've had people here who do some interviews with other employees who really find out how did they come into their roles and what kind of experiences they built to be successful. As much as possible, attending internal and external presentations to broaden your exposure when you're in the workplace, and really actively engaging in the team or the work environment is really important so that you get the most out of your placements as you have them. So when I was asked to present today, at the time I happened to have a student who was working with me, and so I asked her what questions she would have had as an MPH student who was planning a career in public health. And so she gave me a few ideas about questions that I thought I'd try to answer today from my perspective, in case any of you here today have the same types of questions. But just, to remind you that it's my point of view, and I'd be interested from some of the other panelists. They may answer these questions very, very differently. So in terms of the first question was really about what roles would be appropriate for a recent MPH graduate. And so I would say here at Peel, MPH graduates are most often, they would be entering the organization in a health promoter position. So while they were in this role, they would develop some enhanced skills and build on their competencies in the workplace, and often are looking to transition into a role for a research and policy analyst. So although the work can be very similar between a health promoter and an analyst would be expected to demonstrate a higher level of technical skill and independence compared to a health promoter. For those of you who might be in an MPH with an epidemiology focus, here epidemiologists would be often hired either as an epidemiologist or as a health analyst. The second question was how to select courses to maximize your technical skills. And I would say that the answer to this question is very much dependent on the type of work that you actually want to do. So for a health promoter or analyst, I'd recommend taking a broad range of courses, biostatistics, policy, program planning, and evaluation that expose you to all of the different core competency areas. For example, within our organization, unless you were being an epidemiologist, you wouldn't really need to have the in-depth knowledge of how to complete really advanced statistical methods, but you would rather need to have sort of a general knowledge of the different methods, the ability to critically appraise research papers that have used those methods, and interpret and apply the findings in a program planning. So your courses can be thought of as a way to learn whether a particular area is something of interest to you that you might want to expand on through a specific practicum experience. The third question was, what practicum experiences would provide the most benefit? So when a student asked me this, I thought this is actually a really hard question. And sort of, is it better to have two very similar experiences in your practicum so that you can build sort of more job experience, or take two really different experiences so that you show some versatility? And again, from my perspective, I was thinking it would be preferable to have experiences that demonstrate your skills in two different areas from sort of a broader experience, so that when you're interviewing, you're able to give examples of the different learning and of how you applied that learning in the workplace. But I'd be interested to hear from other panelists that might have a different perspective of how to really make the most out of your practicum experiences. And then the last question was how to build networks that are effective. And I understand that MPH students are often encouraged to build their networks, to open up opportunities, but really how to do this effectively. And so in thinking about what I think works, a couple of things. One is when you meet people, either at conferences or workshops, training sessions, during your practicums, really not being timid and asking them questions about their organization, how they came into their roles, what worked for them, and maybe what advice they would have for you. Telling them about what interests you, and that might help them to be able to think of you if opportunities arise. I know LinkedIn is a really good platform for networking and connecting through your contacts to others in the field, and that can be a useful tool. Talking to your own student colleagues about their experiences and what they've learned from the people that they've spoken to. It might be that one of your colleagues has actually found out something that would be very useful and helpful for you. Volunteering can be a good way to meet others who might be knowledgeable about opportunities, but you really need to make sure that those people that you meet know what you're interested in and what your skills are, so that they can identify you for those opportunities. And although I know sometimes it works for some people, the idea of actually cold calling people in public health to discuss your career interests, sometimes that's quite a challenging thing to do, and for many of us in the field, there's really not enough hours in the day to make these kind of interactions a priority. And so sometimes it's better to wait until there's a particular opportunity that you want to speak with somebody about. But again, these were just sort of my perspectives on these questions that got asked. So maybe if we have some time at the end, if any of the other panelists have any comments, I'd be interested to hear them. So that brings me to the end of my remarks. So I think I'm going to stop sharing here. And then Emma.
Yes, thank you so much for that presentation. We will now open things up for questions. And so if you haven't already submitted your questions through the Q&A feature, please go ahead now, and I'll ask Emily and Shovita, and Nancy to turn on their videos. We have, there was one question that came in much earlier. So a lot of this webinar content was focused on people with Masters of Public Health degrees. What about people in PhD programs? Anything that you could say that would be particularly relevant to them? Go ahead, Dr. Petty.
Yeah, I'm just, sorry, was this in the question box or? Yes,
but it was it was answered
okay.
To a degree. I'm just inviting any additional comments.
Yes, so just, sorry, my apologies. With respect to PhDs, we do hire, it's interesting, actually a lot of our policy analysts have PhD backgrounds. Some may have not actually even come from a public health background, but they have a lot of the skills that we need in our policy analysts. So some of them may have done a lot of project management, as well as extensive literature review. So a lot of those skills that you develop during your PhD are actually also transferable. And from PhD programs, we've actually hired some new grads, and I think it's because they've had more time to develop and hone those skills. But yeah, so I'll just leave it at that.
Great.
Sorry,
did you want to add
Nancy,
something?
No, I was just going to say, I think that, sorry, I can't share my video for some reason, but I would say we do have several people here who have PhDs. Oh, look, there I am. We do have some people here who have PhDs, and they're typically people who are in advisor roles that work directly with some of our senior leaders in sort of the strategic areas of practice. And so we do probably have people who have sort of a research background, a community psychology or research background, or people who have different training in terms of sort of the policy analysis.
Great. Okay, so there are a number of other questions, so we'll try and bundle if we can. But so you raised the point of lived experience, Dr. Patty. So if someone's asking, if I share my lived experience, how could I present that without being potentially stigmatized? For example, if I have a chronic illness and I can inform chronic illness programming, someone that's hiring might think, well, I can't do the job because of my condition.
Yeah, that's a really good point. Unless the job description explicitly advertises someone with lived experience. So as many of you are aware, in BC, we're amidst an unprecedented overdose epidemic, and we are actually seeking people who have lived and living experience with substance use, but that is specific in the job posting. And so in those instances, yes, you would mention that in the job interview because that's part of the criteria. But with respect to, positions that may not explicitly say that, my advice is probably not to mention that, but as you start working within the organization, as you feel comfortable and you develop trust with your colleagues, is to start bringing forward that experience. That's kind of one take on it. It also depends on the organization you're applying to. Some organizations are more progressive about these things, others may not. But also keep in mind your respective provinces with respect to employment actually do have acts in place that cannot discriminate against people with disabilities. So, I do think you have to be a little bit careful, but once you're in a setting, I think it is of value.
Thank you. So before we come back, this person had two questions, but there are a number of other people with other questions. So if we have time, we'll get to that second question. But quite a few participants are asking about how they can get a career in Canada, given that they might have received their training abroad. So they did their MPH in another country, and maybe they grew up in an entirely different country as well, and so they're new to Canada, are interested in working here. What can you say to that person? Do you want to go ahead first, Nancy?
Yeah, I mean, I think that we, through our processes, I mean, I think our HR processes would, people, if they apply for positions, there have been situations where people have received their training in other countries, and I've had to actually, sort of look into what those courses would be about. So I think one sort of practical piece in terms of when you're doing an application or writing your CV, describing the program and sort of what were some of the content areas, what were some of the courses you took, what were some of the expectations in terms of whether you did a practicum and in what kind of role would be important, because, you know, we do get to, you know, sort of familiar with what some of the local programs include, and so you can just look at it and sort of know what kind of training people had. But I would say if people want to really, you know, sort of in their resumes or cover letters or whatever describe the programs, that actually might help, because it'll help us to get a sense of whether that's something that's really comparable to an MPH program here, for example. And I would say that that's kind of just a really simple thing to do.
Okay, thank you. Would anyone like to add?
Yeah, you know, Nancy, I think, nailed most of the points. I think it is, and this is just the reality of what it is. It is easier if you're already in the country and you have your immigration processes started. I think it's a lot more challenging if you're applying abroad, but I'm only speaking in the sort of from our context in a health authority. I think if you were to apply to other community-based organizations or nonprofits, you might have easier time. So I'll just leave it at that.
All right, thanks. There's another question from someone who's at the undergraduate level and doing a public health certificate and a 6-week clinical in a public health office. Any suggestions that you can provide?
I can just speak for our organization, is that we have to, you know, we do have nursing undergraduate students, but I don't think we do have a lot of, in my experience, I don't think we've had a lot of undergraduate students from other areas. I mean, I think that partly becomes a very logistic thing for us in terms of having affiliation agreements with universities that cover students who come to our organization. Unfortunately, there are, you know, just, you know, legal considerations for us. So I would say to somebody who's in an undergraduate program, you know, really reaching out to your university and the program and finding out sort of what organizations are able to take students from their program, because it's not all programs we you know, we just wouldn't be able to in terms of from a legal perspective. So I would say that for an undergrad, you'd really have to kind of work with your university to find out where they've had previous student placements.
Yeah, I agree with Nancy. And to add to that, other than the what I would deem the sort of the professional streams like nursing or public health inspectors, those generally come from an undergrad stream. But from this sort of a general public health undergraduate background, we generally don't have any positions with that unless you go into your master's in the areas that I had mentioned before. And so, you know, yeah, definitely connect with your university, but you may have to actually pursue further education, you know, and then really, like, I think Nancy did a wonderful job. She put a lot of detail into her presentation about the skills. She went into a lot more detail than I did about what's needed, and that can help boost your job prospects upon graduation.
Great, thanks. Someone else asked about ways to get involved in public health. Specifically, what kind of volunteer positions should they look into?
I don't think. Oh, sorry. Go ahead, Nancy. Yeah.
No, that's okay. I was just going to say, I do think we do take, like, our Regional Appeal does have a volunteer program, and so people can identify that they would like to volunteer in public health. It really depends on sort of what their skills they get matched to programs based on what their skills are. And if I think of some of the people that we have had, a lot of their volunteer work ends up being in either an international sort of an NGO or a government or a community community-based organization here in Canada, and that's, I would say, seems to be the most typical volunteer experience that we have, where people are sort of tying that into the work they might do at public health.
I was going to say the same thing as Nancy, so I won't take up any more time.
Okay. Well, we have another question. Is it better to be a generalist or a specialist?
I love this question. I'm actually, and people will challenge me on this, but I'm actually a proponent of the specialist, the various streams of MPH programs, because you only really have 1 to 2 years to hone these skills. And I find that the specialist positions, at least in my experience, are a lot more hireable following their education. Because they get a chance to really hone skills in a particular area, such as epidemiology, or whether it's that health promotion, community development piece. I think in a 2-year time frame, I think it's tricky to be good at everything as a generalist. That saying, though, I am actually a generalist medical health officer, but my training was, not only did I do an MPH, I did 5 years of residency training. And so in a variety areas and aspects of public health. So if you love general public health, you may have to consider going to medical school and then doing another 5-year residency.
And I shouldn't even answer. I was an epidemiologist, so I obviously think that that's the best career choice. But but I do think I agree that it is challenging when you have the sort of the more general MPH program or degree, because you do have, you are competing against for positions with people who maybe, have had more of a focus either in their practicums or also in the courses. And so that it's really one of those things about, for a large health unit, competition for positions is significant, and I think that one of the things that Shavita said before about thinking about going into some of the smaller public health units or more of the remote areas, I think that can actually help, because one is that there's probably maybe less competition, but also I think the experiences you get would be so much more comprehensive. Here we can have, specialists who do become very specialized, which is good, but it also means that you would get experience in one particular area, versus in a smaller health unit you could be the jack of all trades kind of from a technical perspective. And I think that is a very different kind of experience, and can be really a good starter for people who are just coming into public health and want to be able to get a sense of what are the different areas, and then maybe they decide that there's one area that they like better than another, but they'd have sort of some real work experience to be able to help them make that decision.
Yeah, I just want to echo that. Like I did that after I completed my residency in 2013. Although arguably Saskatoon itself is a pretty major city in Canada. I was coming from Toronto, which is much larger. But Saskatoon Health Region comprised of 100 other towns and villages, and it was a phenomenal experience, just the breadth you get, but you also do get some depth as well. And I can't stress it enough. Like, I think if you're early on in your career, go out to these different places. It'll be outside your comfort zone, but you are going to have such an amazing experience in public health.
Terrific. Thank you